Glutamine is considered a non-essential amino acid, but that doesn't tell the whole story. Under times of stress, your body cannot produce enough glutamine to meet its demands, and this is fairly widely acknowledged. I'll lead with a quote here. During severe metabolic stress, more glutamine must be produced and released to meet increased metabolic demands for rapidly dividing cells such as gut and immune system. This is also what you're seeing in this diagram. Normally, our body can, again, produce enough glutamine. This is why it's considered non-essential. Your body can synthesize it to meet the demands. And the glands that are predominantly in charge of said production include liver, skeletal muscle, lungs, and fat cells. And the users, the tissues that require the glutamine, that soak up and metabolize glutamine, include brain, gut, and immune cells. Now, what happens during periods of stress? And stress can be psychological stress, but also metabolic stress includes chronic inflammation, infection, tissue injury. So under these situations, now there is no longer enough synthesis, and what ends up happening is consumption outpaces synthesis, and we start to see deficiencies in these key tissues, including the gut, the immune system, and the brain. And this is why glutamine has also been described as a conditionally essential amino acid, meaning during periods of stress, the body needs more than is typically able to be produced. Now, this begs the question, are you getting enough glutamine in your diet? Now, the simple answer is if you are not under metabolic stress, as outlined a second ago, then you probably are. But if you are someone with chronic gut immune or neurological issues, let's say bloating, constipation, diarrhea, SIBO, fungal overgrowth, immune compromise where you get sick often, you have autoimmunity, you have potentially recurrent viruses, or you experience mental fatigue, brain fog, insomnia, then it's more likely that you are unable to produce enough glutamine to meet these metabolic demands and therefore could benefit from supplementation. Now, as context, the typical diet contains 3 to 6 grams of glutamine per day. The research studies are demonstrating, and we'll detail this more in a moment, that anywhere between 10 up to 30 grams of glutamine per day are what's needed during these times of physiological stress. So a great start from a dietary perspective would be whey protein, 4 to 6 grams per serving, beef, chicken, fish, 1 to 2 grams per serving, eggs, 0.6 grams per serving. So these help get you to that minimal intake, I would argue, under times of stress of 10 grams per day. But as we'll detail here in a moment, some studies have found that you can repair the intestines or reduce leaky gut at dosages between 15 to 30 grams per day. So while diet is a very important starting point, it may not be enough to cover the needs for people with increased demands. If you're new here, by the way, welcome. I'm Michael Ruscio. I'm a doctor in clinical practice. I also work as an adjunct professor and as a clinical researcher, and our group has a few papers published in scientific journals with a few more on the way. We've covered that glutamine, even though it's technically known as a non-essential amino acid, it can become essential during certain conditions. One of these is when there's chronic issues in the gut. Now, issues is sort of a catch-all term, but if you're exhibiting chronically digestive symptoms, this might be bloating, pain, altered bowels, reflux, then it's more likely that your body's not producing enough glutamine or you're not getting enough through your diet to meet the demands. Part of what's happening here is the glutamine is fuel for the enterocytes, for the digestive cells to make energy so as to repair and prevent things like leaky gut. And unfortunately, when that leaky gut does occur, this begins a cascade that crosses these 3 systems that we've discussed just a moment ago. The gut, of course, since the barrier function is now compromised. That dominoes over to triggering the immune system and even further toward triggering the nervous system. So this is actually a pretty common cascade we see stemming ultimately from the gut, but permeating across these three systems, and glutamine is needed to enhance or normalize function across all three in times of excessive demand. By the way, if you are also new here, if you wouldn't mind liking, subscribing, or commenting, this really helps the channel to reach and to help more people. Now, here's a few studies. I think even the most skeptical of dietary supplements has to acknowledge the study from Kiki Zhao at Tulane University, 2019, randomized controlled trial. So we're getting placebo versus intervention, meaning like a sugar pill versus the actual glutamine, taking 100 people with IBS. And there was an improvement in pain, bloating, stool consistency, and maybe most interestingly, gut permeability or leaky gut in this group of 100 IBS patients. That was one of, I think, the most keystone studies showing us that glutamine is at least part of a plan to heal and repair and restore function of the intestines. Now, not all data here agree. There was a meta-analysis, so a meta-analysis is going to summarize most of, if not all, of the available clinical trials. And this meta-analysis concluded that glutamine supplementation did not improve leaky gut. However, there's one caveat here. When they sub-analyzed across different doses, they did find benefit in reducing leaky gut when the dose exceeded 30 grams per day. Hence my comment earlier that anywhere from 15 to 30 might be needed under high demand circumstances. And another, I think, very timely study from the journal Frontiers in Nutrition combined glutamine with a low FODMAP diet. Now, the low FODMAP diet strategically reduces foods that are known to feed bacterial overgrowth. And this bacterial overgrowth can be part of the etiology, part of the underlying cause of gas, bloating, pain, and altered bowels as seen in IBS. What they found was the combination led to a greater improvement in symptoms than the low FODMAP diet alone. Now, this included a few very important measures. Global IBS severity, so this is going to assess all of the IBS symptoms, bowel habits specifically, and perhaps most importantly, quality of life. Quoting the researchers here, our findings indicate the superiority of adding glutamine supplementation to a low FODMAP diet in amelioration of IBS symptoms. So glutamine might be able to enhance the efficacy of whatever the primary intervention is, in this case, low FODMAP. Perhaps in other cases, some sort of antimicrobial therapy, let's say if SIBO, small intestinal bacterial overgrowth, is present. Now, to give you the most sort of even perspective on what the research is showing regarding glutamine, not all of the data here agree. A 2021 systematic review did not show any consistent benefit for leaky gut, symptoms, or inflammation. However, again, the subgroup analysis here, given the fact that this study summarized 7 different randomized controlled trials, and the dose and the duration differed across trials, this is where a subgroup analysis can help us see, well, maybe there's a better duration or dose when we look at comparing across the various trials that have been performed. And what they found was in the one study that was 8 weeks in duration, they did find benefit. There was no benefit for shorter duration supplementation, 1 to 4 weeks, but there was benefit at 8 weeks. Now, they found improved gut permeability, but also, I think very importantly, an improvement in what's known as the villus to crypt ratio. You've probably heard that the intestinal tract, the small intestine most namely, has these villi, small finger-like projections that increase the absorptive surface area. And if you spread this out, it would be akin to the same size as a tennis court, which is pretty amazing. These villi, you have the finger-like projections, but you also have a crypt, and that's sort of the deep pocket in between the finger-like villi. What happens in conditions of stress, inflammation, or even autoimmunity is those villi shorten and the crypts become deeper. And even interestingly, there's a theory that I think is gaining increased acceptance, although it's definitely a nascent and a newer theory, or at least the acceptance is more nascent, that as we repair this villus to crypt ratio, we actually allow the body to better expel things like bacterial overgrowth, fungal overgrowth that can sort of hide in these pockets, or perhaps even infection. And without going too into some of like the nuanced details, there was a very timely and interesting lecture by Dr. Simon Yu. He was citing data. I found this really interesting. When undergoing a deworming treatment campaign for immigrants, and I believe, don't quote me on this, but I believe the immigrants were coming from Cambodia, where there's a known fairly high infection rate with helminths or with worms, hookworm, fluke, roundworm, tapeworm. Upon treating the worms and then issuing follow-up testing, they found a 6 times higher rate of amoeba infections. So this is my speculation, but what may have been happening there, as the worms were removed, the villus to crypt ratios improved, the intestines became healthier, and those crypt pockets that infections can hide in and cause these chronic, lingering, low-grade symptoms were now flushed out. So this is why Dr. Yu recommends, when treating for a diagnosed or suspected infection, to use a broad spectrum sort of layered approach, so that if, as the primary infection is being cleared, there are other organisms that have burrowed into those deep crypts, you make sure to flush out or be able to eradicate the other organisms that are coming to the surface as the intestines are healing. Irrespective of all the details, the take home here is that glutamine helps to repair the villus to crypt ratio. You have a better villi and you have a less deep crypt, and this is going to be better for absorption and less conducive to development of infection. Okay, so we discussed this cascade from gut to immune to neurological systems. Let's talk a little bit more about the immune system, because this is also, I feel, a very underappreciated area where glutamine can exercise significant benefit. Quoting one paper, glutamine is probably the most widely recognized immunonutrient, as it is required for key immune inflammatory responses. Remembering that the instrument of cleaning up of the immune system is inflammation. One of the ways I think of this is glutamine facilitates what I term, this is just my moniker, the macrophage military. We know that glutamine will help facilitate function of many types of immune cells, including macrophages, T cells, and B cells. But there's a very important coordination that takes place across these cells. Glutamine fuels this entire communication network. Glutamine allows macrophages to perform their sort of first responder function, which in part phagocytizes or eats or attacks germs and other pathogens. Simultaneously, the macrophages hand off a very important signaling function to T cells. The T cells help to tag germs or pathogens to tell the body to make antibodies against that germ, and those antibodies are the B cells. So macrophage will first respond, T cell will tag, and B cell antibodies will come in for another round of attack, if you will. Now, if this response is coordinated accurately, you have effective eradication of germs, pathogen, infections, what have you, while simultaneously you reduce the likelihood that the T cells will inappropriately tag food particles, food allergy, or environmental particles, environmental allergy. So there are significant ramifications for the impacts that glutamine has on the coordination and function of this immune symphony, starting with the macrophages, going all the way through to the B cells. Now, glutamine has been fairly extensively studied in post-surgical and critical care settings just to provide a model through which we can understand the immune-enhancing effect of glutamine. And consistently, it's been demonstrated that glutamine will reduce respiratory infection rates, support faster recovery, and boost post-surgical immune function. Another study I found interesting was in combat athletes, where glutamine supplementation enhanced mucosal, so this includes but is not limited to the gut mucosa, but also the respiratory mucosa. It also improved the testosterone to cortisol ratio meaning exercise, when it's excessive, may lead to more cortisol production than testosterone production. In fact, some have argued that if exercise routines exceed 1 hour, you run a risk of having an inappropriate ratio of testosterone to cortisol, where cortisol outpaces testosterone and the exercise becomes catabolic or tissue destructive. So glutamine may help balance this response and prevent the catabolism, the breakdown from intense exercise. One study in particular, in the same vein, looking at COVID-19 patients who supplemented with glutamine, found a lowering of levels of inflammatory cytokines. Okay, let's discuss glutamine and the brain. Glutamine is a precursor for two very important neurotransmitters in the brain. One excitatory, glutamate, and one inhibitory, GABA. And having sufficient glutamine helps to have this balanced neurotransmission where you have adequate ability to focus and have motivation, but also be able to turn off, not have anxiety, let's say, and be able to sleep. The glutamine deficiency or aglutamine deficiency may be part of what underlies poor mental performance, brain fog, fatigue, anxiety, and again, a hard time falling asleep. There was one study that hinted at this. 2020, the researchers actually had a very elegant design here where they used high-resolution brain scans to measure the amount of glutamine in a key brain center that regulates motivation, the nucleus accumbens. And what they found was a higher level of glutamine in this brain center actually predicted better performance for a demanding task. So people had more stamina, less mental fatigue, and lower perceived effort, leading these researchers to conclude glutamine levels related to better performance and reduced effort perception. So just one thing to think about also, especially if someone has a lot of stress, their training load is fairly high, and especially if these things are present, plus loose bowels, food reactivity, diarrhea, constipation, bloating, abdominal pain, then what might be happening is this all too common cascade that dominoes from gut to immune and to nervous systems. Regarding glutamine for muscle, glutamine does not appear to improve muscle protein synthesis nor improve muscle mass. But what glutamine may do is help function as a reserve, which is partially depoted in the muscles, so as to have a source to pull glutamine from to fuel the gut, the immune, and the nervous system demands. This also may be one of the reasons why there's a very tight correlation between muscle mass and what's known as all-cause mortality or death from any cause, because the muscle mass is a symptom of healthier physiology that has ample glutamine. Well, taking a step back even further, does not have the metabolic stress created by IBS, leaky gut, that's not cascading over to taxing the immune system, causing this sort of aberrant macrophage military response, if you will, that leads to a reduced ability to kill pathogens while simultaneously making someone more sensitive to foods and environmental allergens, and then cascading further over to the brain. So when this sort of metabolic domino cascade is not present, then the body will not have to pull glutamine from the muscle tissue, and therefore, theoretically, people may be able to maintain better muscle mass. And there was one study that did find that glutamine supplementation after exercise actually reduced what's typically observed, which is this induction of leaky gut transiently after intense exercise. So we at least have some hint, again, that the glutamine is not helping repair muscles per se, not something like leucine that's highly anabolic and reparative, but rather it helps provide the precursor so that we don't strip as much glutamine from the muscles and we have ample glutamine stores to fuel repair of the gut amongst other systems. Okay, coming to a protocol for use. Firstly, there is no recommended dietary intake for glutamine, given that it's not a essential amino acid, but remember, it is what's known as a conditionally essential amino acid. What I'd recommend, and this is a synthesis of across these studies that we've discussed in terms of the cohorts that were studied, the doses that were used, and in some of those sub-analyses, the doses that were found to be the most effective. For general health, wellness, prevention, anywhere between 5 to 10 grams per day, taking in divided doses. Usually you don't want to exceed more than 5 grams per dose. There is an absorption limitation. If you exceed that, and this is per dose, if you spread it out, you get around that absorption limitation. But if you exceed 5 grams by much, then there is a chance of causing gastrointestinal upset. For gut repair, for training support, 10 to 30 grams per day. And then if there's intense stress or overt illness, a disease state, or infection, then over 30 grams per day. I would start slowly. I would titrate up to that 5 grams per dose, and then hit however many doses per day, again divided, to achieve the full target dose based upon a given group that you may be in. And also remember that the higher doses should be used in a truncated fashion while trying to repair the guts, fight the infection, whatever it is, and then reverting back to more of a general health 5 to 10 grams per day for longer term, or just simply relying on good dietary intake. And this is where I think there's a good rationale for a whey protein supplement. The form being L-glutamine, and I think it's much more practical to use a powder because it ends up being a lot of pills, especially if you're trying to get to, let's say, 20 grams per day. It can be a lot of pills, but it's much easier to mix what's essentially a flavorless powder in with water or whatever you like. Regarding adverse effects, every once in a while in the clinic, someone will have an exacerbation of brain fog, of gut inflammation from glutamine. And this has not been very well documented in the research literature. I think clinicians are seeing this to some extent, but it can happen if there is dysfunction of the liver, if there's a high degree of neural or brain inflammation, or mitochondrial dysfunction, just to name a few. And I think the best way to get around this is just slowly and gradually upping your dose while also using supports to treat the underlying issue simultaneously. And if you do get tripped up here and you're saying to yourself, well, I'm using the glutamine, I'm seeing some benefit, but I'm still having all these symptoms, then there might be small intestinal bacterial overgrowth, fungal overgrowth, perhaps an infection. And this is where I would say, please feel free to reach out to the clinic. This is what we love to do, is help to guide people through figuring out how to put all these pieces together. In close, glutamine is a conditionally essential amino acid. Supplementation can help support whatever the primary intervention is, so it's a nice adjunct. And you may want to consider being proactive with glutamine supplementation under times of intense stress, whether that's exercise, psychological, getting sick, what have you. And I thought I would wrap things up with a quote from Oprah Winfrey: "Turn your wounds into wisdom." So let's say, as one example, you had a very high stress period. You noticed you developed food reactivity, bloating, and loose bowels therein. Going forward, you can look at glutamine as a potential preventative measure to reduce some of those negative symptoms during that time of stress. Okay, well, I hope this helps. And if you've tried glutamine or you're going to try it, let me know what you think in the comments. This is Dr. Ruscio. I will talk to you next time.